Hello and welcome to PCR TV. We're at EuroPCR 2016 and I'm with my colleague Zughart, who's the cath lab manager, and my name is Karen Wilson and I'm the lead research nurse from St Thomas's in London. We're here with you to discuss the Nurses and Allied Health Professional programme that's been going on at EuroPCR 2016. So David, if I can just ask you a few questions about the Nurses and Allied Health Professional programme, if you can give me basically a brief history of this.
Yeah, this history began back in 2004 when we created some separate sessions for nurses and allied health professionals. We expanded the program a couple of years ago in 2014 and made a major change that actually made this for 4 days integrated in the whole PCR program.
Wow. And you've been having many more sessions over the 4 days?
Yeah, we have a couple of new sessions as well. We have this format of learning. We have abstract sessions. We have dedicated sessions for what's new, sort of like the TAVI procedures and the left ventricular assist devices also, which have been very good to cover. Because this is one of the major courses for nurses and allied health professionals, that they get what's new, what we have to know about to play our part in the multidisciplinary team.
Absolutely. And with the expansion of the programme, have you seen more nurses and allied health professionals coming and registering at the course?
Yeah, actually we have a quite impressive increase the last 2 years from about 400 to 600 last year. So that's really something. It's
a really good expansion. And because of this, is there something special that makes these sessions more appropriate for nurses and allied health professionals to attend?
Yeah, I think the trademark from the start of this program is the very warm environment, very friendly, very easy to ask questions, and very active in helping each other to bring out the best message, because the best message is also what's bringing back the best care home for your patients.
Definitely. And the people who get to present at these, are they the nurses and the allied health professionals, or do you have the doctors coming to talk to you?
No, actually we are by clinicians for clinicians. We fully integrate the PCR concept, and mainly nurses and allied professionals such as technicians and biomedical scientists that are doing the presentations. Occasionally we bring in the medical experts, but we think this format is very good and works.
Excellent. I'm sure if it's a session for nurses and allied health professionals, they hopefully feel comfortable at asking questions.
Exactly. And so all those questions that you may have back in your home, in your cath lab, maybe you don't have time, maybe you don't have the courage to ask this to your consultancies. So I think absolutely this is a very important part of the success of the EuroPCR Nurse and Allied Professional program.
Absolutely. I understand this afternoon there was a new session for complex PCI, really looking at the multidisciplinary team and how the nurses, physiologists work with the doctors. Can you just tell me a little bit about that? Yeah,
this was an extremely lively experience, and we were actually in the PCR sharing center, which by the way is a fantastic environment. So this was an experimental session created by Professor Marco. So we were nurses and physicians facilitating, and nurses and physicians in the room around small round tables, discussing a patient file and together trying to find the best solution for this complex PCI cases.
Excellent. And did it go well?
Yeah, I think it went very well. It was very interactive and a lot of questions in the room that wouldn't have been asked in an ordinary setting.
Fantastic. So as you can see, it's been a very busy programme. If people are watching this and actually want to get involved, how do they go about doing that?
Yeah, we're very happy about for the conference that people around Europe are sending in abstracts and clinical cases. Also, we think the PCR online is a very good tool. We have a special dedicated page for nurses and allied professionals there. Also, we have the EuroPCI, which is the Nurses and Allied Professional Committee, just releasing a new educational plan, a core curriculum that we're very proud of. So please visit the EuroPCI homepage and the LinkedIn group, which by the same name.
Great, thank you, David. So as you can see, it's been a full programme for nurses and allied health professionals this year at EuroPCR 2016. We'd like to encourage people to get on board and to come and participate and to attend next year. Thank you very much.